Artificial Intelligence Doctor. User question. What is the relationship between International Prostate Symptom Score, IPSS, measurements and objective urodynamic parameters in determining total urinary output in BPH patients? Claude AI answer. Let me break down the relationship between IPSS measurements and urodynamic parameters in BPH patients. IPSS components and urodynamic correlation. Weak stream, IPSS Q5, strongly correlates with maximum flow rate, Qmax, detrusor pressure at maximum flow, PDET Qmax, bladder outlet obstruction index, BOI, key urodynamic parameters affecting total output. Maximum systometric capacity decreases with higher IPSS. Post-void residual volume typically increases with higher IPSS. Detrusor overactivity is more common in patients with higher scores. Bladder compliance often decreases as symptoms worsen. Storage symptoms versus urodynamics. Frequency and nocturia, IPSS Q2, Q7, correlate with reduced functional bladder capacity, decreased bladder compliance, presence of detrusor overactivity. Clinical significance. IPSS alone is not always predictive of urodynamic findings. Some patients with high IPSS may have normal urodynamics. Total urinary output patterns often show increased frequency with smaller volumes, higher post-void residual volumes, altered day/night ratio of urine production. Research limitations. Most studies focus on correlations between individual IPSS questions and specific urodynamic parameters. Few studies comprehensively examine total 24-hour output patterns. Limited longitudinal data on how these relationships change over time. Would you like me to elaborate on any of these aspects or explore other relationships between IPSS and urodynamic findings?